Batman looked a little out of focus there. We're going to start off this next hour with my monologue, which I was not able to do in the first hour. I'm going to be reading excerpts, say that 10 times fast, from Saying No to Vaccines, a resource guide for all ages by Dr. Sherry Tenpenny. This book should be on the shelves of everybody in the world. Saying No to Vaccines, a resource guide for all ages by Dr. Sherry Tenpenny. This from page 30. Moving on forwards. The global smallpox vaccination program is not nearly as successful as it is touted to be. If the science of vaccination worked, it should have completely prevented epidemics. But instead, while the population of England increased 16% during the years of compulsory vaccination, smallpox deaths increased 160%. A figure that does not include the deaths from the vaccination itself. The only complete series of official records in Europe revealed that the decrease in smallpox mortality paralleled the decreased use of the vaccination, which means less people died the less they were given the vaccines. Moreover, some of the most severe epidemics on the continent occurred after the onset of compulsory vaccination. Vaccinations are not what they are touted to be, and it's not a belief, it's not speculation, it's not a theory, it's an academic fact. And the fact that your medical doctor overlooks this stuff, quite frankly, is criminal in my behavior. In a report published in an early edition of the British Medical Journal, Dr. L. Parry analyzed vaccination statistics and asked the following questions. How is it that smallpox is 5 times as likely to be fatal in the vaccinated population as in the unvaccinated? How is it that in some of our highest vaccinated towns, Bombay and Calcutta, smallpox is rife, whilst in some of our poorest vaccinated towns, such as Leicester, I know I butchered that, Leicester, it's almost unknown? How is it that something like 80% of the cases admitted into the Metropolitan Asylums Board smallpox hospitals have been vaccinated, whilst only 20% have not been vaccinated? You would think it would be the other way around. That from the British Medical Journal, by the way. By 1897, a weaker form of smallpox, variola minor, became the dominant strain in the U.S. Although the rash was similar to classic smallpox, the new form was a mild disease, left little scarring, and only rarely caused death. The illness was considered an inconvenience more than a danger, especially compared to the risks of serious harm from vaccination, which included infection, gangrene, and even tetanus or syphilis. Imagine that. Nevertheless, pro-vaccination publications issued by health departments often used gruesome photos of the worst cases of variola to generate fear. This coercion technique allowed vaccination to continue in the U.S. until 1971, even though the last reported case of smallpox was in Texas in 1949. Here's a myth that's promulgated by the medical industry quite frequently. And by the way, this is a preamble to tomorrow night's webinar for Dr. Glidden Insiders and their guests exclusively. Vaccination Part 2. Tomorrow night, 8 p.m. Central Time, for Dr. Glidden Insiders and their guests exclusively. Vaccine-induced antibodies provide protection against infection, disability, and death caused by vaccine-preventable diseases. Antibodies are a sign of protection. This is a myth. The role of vaccine-induced antibodies in disease prevention is unclear. A new vaccine is developed with the intent of stimulating the immune system to produce a protective antibody. Physicians believe that the presence of an antibody is proof of immunity and protection from the illness. However, even the medical journal Vaccine reported in 2001, I quote, it is known that in many instances, antigen-specific antibody titers do not correlate with protection. Do not correlate with protection. That from the journal Vaccine. Many who have been vaccinated and developed antibodies contract the disease, and those who do not develop post-vaccination antibodies do not become ill. Is it the presence of an antibody that defines the state of the person's resistance to an infectious disease? Well, your medical doctor will say yes. And that's how they judge the efficacy of any type of a vaccine, by giving somebody the vaccination and then waiting a certain number of weeks, drawing their blood again and seeing if the antibodies to whatever they vaccinated you against have increased. The belief here is that the more antibodies you have in the blood, the better protected you are, but the scientific literature does not support that fact. It's kind of like medical doctors believing that heartburn is caused by too much stomach acid. It's not. Kind of like medical doctors believing that type 2 diabetes is genetic. It's not. Kind of like medical doctors believing that congestive heart failure is, genetic. It's not. Medical doctors get it wrong all of the time, and you continue to give them your hard-earned money in the form of medical insurance premiums. You need to stop it. You need to snap out of it. You need to get a clue. Next time you go to the restaurant, have the waitress bring you a clue. Here's some references from the literature regarding this whole notion that antibody titers, the presence of antibodies in the blood, has anything to do with immunity. Pertussis continues to cause significant death and mortality in infants and children throughout the world, even in well-immunized populations. Laboratory measurements of antibodies have not demonstrated a level that corresponds to protection. That from the Clinical Diagnosis Laboratory Journal Immunology, 1999. Determining the correlation between the level of antibodies in the blood and immunity to pertussis has been difficult. It is unlikely that the association can be ascertained. There is no direct association between antibody levels that ensures protection from pertussis. This from the journal Infectious Immunology. Again, there is no known direct correlation between levels of specific pertussis antibodies and protection against pertussis. That from the Canada Communicable Diseases Report issued in 1997. How about mumps? Little is known about the correlation of mump titers and protection from mumps. That from the Journal of Clinical Microbiology, 2005. Pneumococcus. The results from several randomized studies show that the polysaccharide pneumococcal vaccine does not appear to reduce the incidence of pneumonia or death in adults with or without chronic lung disease or in adults who have other chronic illnesses. Neither does the vaccine reduce the incidence of pneumonia or death in persons 55 years and older. That from the Cochrane Library, issue 4, 2003. Seasonal influenza. You got a seatbelt. You want to fasten it. A serum antibody titer of 1 to 40 does not guarantee protection from influenza infection. People with lower titers show protection against influenza, and people with higher titers can have symptomatic infections. Moreover, the assumption that a titer value of 1 to 40 or greater will protect an individual from infection is valid only if the virus causing the increased titer is exactly the same that is in circulation during the flu season, and it never, ever is. The vaccine that is rolled out this year was based on influenza viruses that were obtained a couple of years ago in China. It is not relevant to the circulating virus which is present in the world in any given flu season. They don't have the technology to keep up with that. Well, maybe they do, and they're just not doing it. It's just really, really crazy. It goes on. The last thing I want to read here. Here's another myth. Vaccine-preventable diseases of childhood can be serious. If your child is not vaccinated, your child could contract one of these illnesses and die. This is a myth. This is a typical example of fear-mongering tactics used to coerce patients into vaccinating. Certainly, childhood illnesses can be serious in some children. However, the vast majority of children who contract a vaccine-preventable disease, quote unquote, experiences a week or two of discomfort, fever, vomiting, and a rash. They pass through the childhood illness and recover uneventfully. While rare complications can occur in any child, the underlying health of a child who experienced the complication is unknown. For example, was the child immunocompromised by drugs such as steroids? Was the complication associated with other illnesses such as congenital heart disease or cancer? Data generated from the Center for Disease Control documents that the mortality rate from pediatric infectious diseases declined to low levels before vaccinations. Before vaccinations were present. You have been fed a boatload of crap by the pharmaceutical industry. Now look, we are not against, things just because the pharmaceutical industry rolls them out. We're against inaccurate, fuzzy, inarticulate, bad science delivered to you at a profit. That's what we're against. Every time I go to the dentist, I thank God for Novocaine. Love that drug. Love that drug. Thank God for penicillin, sometimes. Thank God for morphine, right? Thank God for the sterile technique. Love that stuff. It's really great stuff. It's not the drug, it's how it's used. When MDs use vaccines, they use them willy-nilly, and they are not paying attention to the published literature because they are intellectual cowards. They do not want to step outside of their comfort zone, and they'd rather just do what their colleagues have always done, just stay inside the fold. It's a herd mentality, rather than actually pick up a book and do some learning. I mean, all of the stuff that I talked about here, and there is so much more, was published in mainstream vaccination medical journals. It wasn't as if they had to hunt and peck for this stuff. It's right in front of their face. But, when it goes against their conventional wisdom, they ignore it. It's crazy, man. Crazy, crazy, crazy. We've got new people coming into the chat room all of the time. People sick and tired of being sick and tired. People sick and tired of just being strung along by their MDs, paying gobs and gobs and gods of money for nothing. Nothing. Well, they do get something for their money. They get ineffective, dangerous, expensive medical strategies, the intention of which are not to fix the flippin' problem, but to manage it. Let's go to Bonnie in Wisconsin and see what she has to say. Hey, Bonnie, thanks for the call. You are live.
Oh, thank you, Dr. Glidden, for taking my call. This is to update you. This is about the urinary tract infection.
Okay.
With the bleeding, The reason I was calling is you told me to call you back, and I've been taking the supplement program that you told me to take. One EFA 3 times a day with meals, 1 ounce of VTT morning and afternoon, 30 ounces of water, the OsteoFX, 1 ounce morning and afternoon, and 2 ounces at night. The burning, of course, is gone. I told you that last time. But there's still some bleeding, and today it's like a light to clear, but it does get light to medium. Now, I'm over my menstruation cycle. I haven't done it in a long time. So I'm wondering why this bleeding is going on. Part of the infection, I don't know. I also get cramping in my lower abdomen. Now, I to comfort myself, I sometimes lay on the heating pad, or I kind of rock back and forth a little bit,
Yeah.
They're like menstruation cramps, but I've never had cramps like this. They were just a little bit, and then I got it, and I was over it.
All right. Well,
a little bit stronger.
Okay, so the most common cause of this, and, a little bit of extracurricular blood where there shouldn't be, are both lacks of calcium and magnesium, with the lion's share of being calcium here. So my recommendation to you, given this set of symptoms, would be simply for, 5 days, double up on the amount of calcium that you're taking and see if the cramping doesn't go away and see if the urine doesn't clear from the blood. That's what I would do if I were you. How much liquid calcium are you taking right now?
What you recommended: 1 ounce morning, 1 ounce afternoon, and 2 ounces at night.
Okay.
And I've been sleeping at night, which I thought that's pretty good. But also, I need to tell you, yesterday, I ate breakfast, which was like a half a pancake, which is gluten-free with butter. And then I started sipping on the BTT a little bit, maybe 20 minutes after, and I threw it all up.
Oh, you threw it up?
Threw it all up.
That's
and last week I did it once. But like I say, it's not every day. But when the cramping comes, it's like it comes after I eat, maybe. And it's just, like yesterday, I was laying on the bed all day, just kind of rocking myself back and forth and kind of laying on a heating pad for a while, and then.
Yeah, well, something's going on here that's not right. Do you have a chiropractor that you can work with, a chiropractor that you know or that you have any type of relationship with where you live?
Not right now. I don't know of any.
Well,
you need to have one.
Yeah, I would find one because you need to have somebody poke around your abdomen and, give you a sense of what's going on here. This could be any number of different things, but when we see strong and persistent symptoms like this and then, you're throwing up into the bargain, then there's something going on in the gut, which is not good.
Now,
what I would do... Go ahead.
Okay. I've also experienced, some burping and a little gas, which I don't usually do. But it's I think it may be from the product. I'm not sure.
Yeah, most probably is. So here's what I would do. I would continue to take everything, but I would stop the Beyond Tangy Tangerine for 3 days.
Okay.
Stop the Beyond Tangy Tangerine completely for 3 days. See what happens to all of these symptoms. And for goodness sake, I would have a medical professional who's not an MD poke around your abdomen and see whether or not they can give you any diagnostic clues as to what's going on. If you can find a chiropractor who is trained in applied kinesiology, K-I-N-I-E-S-O-L-O-G-Y, I think, applied kinesiology, they are always your best bet, in my opinion. That's what I would do. Give it a shot and call me back with a report. I always look forward to that. Debbie from Missouri is up next, folks. It's like Kate from Manchester skipping class to call me back. I got to love that type of behavior. Hey, Kate, thanks for the call back. You are live.
Hi, Dr. Glidden.
All right.
My class got canceled.
All right. See that? Yeah. That's because the professor was probably, eating gluten for lunch and had an attack, and now they've rushed him to the hospital and they're going to bankrupt him. So, I'm glad you found your way back.
This had happened to me 3 years ago. My husband was going into the military at this point, and we had just gotten married, and my boss found me on the floor.
Yeah, that's a great little job introduction, right?
Yeah, it's crazy. And 3 years ago they're like, it's gastritis. Okay, well, what's causing that? So they're just gonna they gave me Pepsid to ease, to stop the bleeding in my stomach.
Yeah, so this is nuts, right? So gastritis, that's just fancy schmancy doctor talk for inflammation in the abdomen. You knew you had inflammation in the abdomen when you went in, right?
That's why I was screaming in horrific pain.
Yeah. So it's just crazy. So here's what I would recommend that you do, because there's a number of things that can cause this, and we need to dial in what that is as accurately as we can, and the MDs are just going to be useless here. However, you live in a college town, right?
I actually live in the south end of Ware, but I go to school in Manchester. I'm actually
okay, then it's going to be easier than eating a piece of apple pie for you to find a chiropractor trained and licensed in applied kinesiology.
I have a chiropractor.
Oh, I'm not sure that he does kinesiology, though.
I'm not really sure if she does that either.
Okay, so I'm telling you, You need to find a chiropractor who's trained in applied kinesiology, because an applied kinesiologist who's good at what they do will be able to diagnose this for you relatively easily, and they'll be able to tell you, whether it's a mild, moderate, or serious condition, whether it was caused by a nutritional supplement overdose or caused by a voodoo curse. I mean, who knows? It could be a lot of different things here, but when you have a strong and persistent symptom like that, you need to get to the bottom of it. I will tell you off the cuff that a couple of things that cause people to pass out like that spontaneously are dehydration and too much coffee. Dehydration and too much coffee. So if you wake up in the morning and you're late for something, you're late for work, you're late for school, you're late for your spaceship ride to planet Mars, and you skip breakfast and you have a great big, 16-ounce cup of coffee, and you drink it all down in a half an hour, and then you don't have any water for a couple of hours, you can pass out. Because the combination of those two things, no food in the stomach and too much coffee and dehydration, can make you pass out. So that's a common thing that causes that. There are some herbs that can cause that. Longevity has a product called Cell Shield RTQ that if you take too much of that on an empty stomach with coffee, you're going to pass out. But notwithstanding that, and especially because you have a history of this stuff, Kate, you need to go to a competent physician who has the tools to be able to diagnose this, and I'm telling you, a chiropractor who is trained and certified in applied kinesiology is the person for the job. Now, so I want you to go to my website, drglidden.com, and right there on the front page, you don't have to log in, you don't have to be an insider, you don't have to do anything. Under the date on the front page of my website, there's a little search box, and I want you to type in Dr. Matt, M-A-T-T-P-E-A-H-L, Dr. Matt Peel, P-E-A-H-L. And that will then hit the search button or the submit button or whatever it is, and it will immediately bring up to you on that page the radio show that I did where I interviewed Dr. Matt Peel, who is a specialist in applied kinesiology. And if you listen to my interview with him, you'll get a better sense of what applied kinesiology is. And we also talk about a couple of websites that you can go to do a search for chiropractors that have been trained in this methodology. And I believe you need to get this diagnosed toot sweet. And, since the MDs have their heads up.
I agree with you.
Yeah,
I actually have a 14-month-old daughter.
Okay, did you name her Dr. Glidden by any stretch of the imagination? Because that's a really good name.
Elizabeth. No, her name is Elizabeth Lucia.
Well, look, here's what you can do. You can go to the town hall and you can get the name change form, and you can just change your name to Dr. Glidden, and I'll be okay with that. I mean, I'm perfectly fine with that, no problem. So listen, you need to dial this in, okay? So go to the website, Dr. Matt Peel. It'll bring up the radio show that I talked about applied kinesiology with him. Watch that segment. It's free. And then find a chiropractor who's versed in that methodology. And once they tell you what the cause is, call me back, and I'll tell you what to do next. Sound good, Robin Hood?
That sounds good to me.
All right, Kate, go out there and get your health back, and give me a call back once you've dialed it in. Missouri is up next. Let's go and talk to Debbie and see what's going on with her. Hey, Debbie, thanks for the phone call. You are live.
Dr. Glidden, thank you for all you've done, because I've learned so much from you.
You're welcome.
Anywho, speaking about the vaccines.
No. Wait a minute. Christmas is coming up. Christmas is coming up.
Yeah.
So, Christmas is coming up.
Okay. Well, I'll give you something real nice.
I like to play golf. Did you know that? I love to play golf.
Oh, no, I didn't know that. So maybe some golf for Christmas? Okay. Anywho, vaccines. I had all the childhood diseases, and I was fine. So this vaccine thing is a bunch of, whatever.
Yeah, I know.
Anyway,
and see, this is the thing. When you've been through a normal childhood illness, and then your immune system is strengthened, and you're in a much better situation than you are if you got vaccinated for whatever it is they were trying to vaccinate you against. It's just a gigantic scam that has no science, or it has some scientific basis, but it's really just fuzzy, old-fashioned, outdated thinking. But the MDs are never going to change their tune because they're intellectual cowards, and we're suffering because of it.
No, I've been a practicing nurse for 25 years, so I know they're a bunch of dummies.
Well, there you go. And honest to God, if I was elected king of the world, the first thing that I would do is I would put the nurses in charge of the doctors. I would.
Yeah.
And then everything would change. No kidding.
Yeah, me too. Anywho, the reason why I'm calling, I keep saying anywho like an idiot, I have high blood pressure, and I'll give you the list of things that I'm taking. I take tangerine, 2 scoops in the morning and at night, 9 EFAs. I take 6 ounces of calcium a day, either the OsteoFX or the Cal Toddy. I mix it up. I take enzymes before or after meals. I take Ultimate Daily Tabs, 9 a day, Selenium, 8 a day, Sweeties, 8 a day, sometimes up to 15. I fixed my diabetes. I was having fasting blood sugar of 300. Now it's 140, so that's okay. I don't do the 10 bad foods, and I still have high blood pressure and have to take 8 or 10 blood pressure pills a day just to get it to 140 over 8.
Okay, so how long have you been doing longevity?
7 months.
And how long did it take the blood sugar issue to resolve?
6 months.
All right. And how long have you been diagnosed with high blood pressure?
10 years, 15.
Okay, so it's going to take probably 12 months. And this is... this is totally by the, I'm going by the seat of my pants here. The old-time naturopath said that it takes approximately 1 month for every year that you've had the problem to get on the other side of it. You've had this for 15 years, so that's, 15 months, but longevity will speed that up. So I'm going to guess you're just going to need to maintain the discipline here for a little while longer, and then all of the chickens are going to come home to roost. And what will happen, I will tell you what will happen eventually, because we see this all of the time. And it also makes sense, right? I mean, these things have to make sense because we are hanging out in the scientific zone. I mean, that's what naturopathic medicine is all about, marrying the scientific method with non-drug therapeutics. So what happens is, your body's been just tricked out, man. It's been hurt. It's been harmed. It's been hanging on by a thread for the last, 50 years, right? Because you've been eating all the wrong foods. Your body's been completely undernutrified. Now you had to deal with all these medications on top of it. Plus, the stress of life never lets up. So it's like you're walking through a winter snowstorm with a bathing suit on, for goodness sake. That you're just not prepared to handle the stress of life because you're doing all the wrong things because you took the wrong dog to the hunt medically, right? So as you get a clue and you adjust your diet and you get on board with the nutritional supplements, things start to come around. And, the blood sugar's gone. I mean, the blood sugar issue's gone. That's huge. It's a huge thing. So now we expect something else to change and then something else to change and then the blood pressure to go away. And what's going to happen is one of these days, might be tomorrow, might be 6 months from now. I don't know. You're going to wake up and it's going to be like somebody flipped a switch and all of a sudden your blood pressure numbers are going to start to come down into the normal zone. And it's going to happen quickly. It's going to appear to have happened quickly. It's going to be, like the buildup of all of this stuff over all of these years, and your body's kind of getting it back together one molecule at a time, right? And then all of a sudden, the plane takes off, and it's 3,000 feet in the air in 10 seconds. And so you just need to maintain the discipline here and lean on your experience to date to give you inspiration to maintain the discipline. And you are in the hardest category of people to help with medical nutrition because you're in this weird gray zone between dramatic improvements and, future improvements, right? So this is just the this is the way that medical nutrition is. It might help you to go to the gardening center and buy a little tomato seed and put it in one of those little tiny pots, and keep it in your kitchen, and just as the tomato grows, kind of use that as your yardstick for improvement. And by the time there's a nice, healthy, robust tomato on that vine, you should expect your blood pressure to be much better than it is now. That might give you kind of a visual cue to maintain the discipline over time, which is what you need to do.
Okay.
Does that make sense?
I have faith. I believe in it totally.
Well, that's great, and we need, we need faith and we need belief, but we also need that to be grounded on results, right?
Mm-hmm. Yeah.
Which you already have, and so moving forward, you just need more time, Debbie. That's all.
So you think I'm taking the right products? I mean, these are okay.
Yeah, absolutely.
Okay.
And you're not getting any negative side effects, right? No diarrhea. No, you haven't grown an 11th finger or anything like that, right?
Well, I mean, I had some loose stools, but that's gotten better.
Yeah, so you're good to go. No, man, just now, the only thing you could do is just make sure there's no hidden gluten in anything that you're eating, right? As long as that's taken care of, you're good to go, man. Just give it a little more time. Trust me, give it a little more time, and you're going to love how you feel. Derek in Indianapolis is up next. We're going to talk about X-rays. Welcome back, everybody. Dr. Peter Glidden here, your steadfast advocate for health, bringing today's show to a close. We're going to go up to Indianapolis and talk to Derek about X-rays, I think. Hey, Derek, thanks for the call. You are live.
All right. Good to hear from you, sir. And he doesn't screen his call because he let me in.
What's going on?
Well, I just had 3 questions, if you could touch on them, because sometimes people aren't brave enough to call in, so we have to do it for them. I was wondering about when you go to the dentist and you have insurance, quote unquote, and they always want you to, like twice a year or so, get an X-ray on your teeth. And I'm like, well, my teeth are fine and everything's fine. Why do we have to get these X-rays? Because I hear Dr. Wallach talking about ultrasounds versus always getting an X-ray. And the second thing is, why do men get enlarged prostates? I know we have that product, Prostate FX, but I was just wondering, what is it that causes that? And then, for people to get enlarged prostates and then maybe later on prostate cancer. And then the third question would be, if someone already had a kidney transplant, they're a little nervous on trying the product, what would you tell them? Those 3 questions.
Okay, so we'll go backwards. So the kidney transplant, they shouldn't be nervous. They should be excited, because the reason that they got the kidney transplant in the first place was because they had a funky kidney. Why did they have a funky kidney? Now, sometimes it's, you had a knife wound or a bullet in your kidney or shrapnel, or in an automobile accident, your kidney was smashed to smithereens. But most of the time, people have their kidneys removed because their kidney was funky because of metabolic reasons. And, you don't get a bad kidney because you have a kidney. You get a bad kidney because your body doesn't have the right nutrition. So surgically removing the kidney and putting in somebody else's kidney is not going to fix the problem. And it's only a matter of time until the fake kidney gets bad, just like the original kidney did. So the surgical procedure does nothing to fix the cause of the problem in the first place. It's like painting over the mold. Well, in this case, it would be like putting a new piece of drywall over the mold rot without fixing the water intrusion into the basement. It's only a matter of time until the new drywall gets bad also. So medical nutrition attempts to address the fundamental cause of kidney pathology, number 1. Number 2, whenever anybody is on an anti-rejection medication, which they are when they have an organ transplant, the anti-rejection medications will work better and more effectively and more efficiently if they are doing medical nutrition. The vitamins, minerals, and nutritional supplements will help their meds to work better. They will have a better response from their treatment when they're on medical nutrition. Nobody knows what causes prostate cancer. This is a big problem. Nobody knows what causes any type of cancer. We spent $1 trillion on cancer, and all that your oncologist can tell you is, oh, it's genes, it's genetic, which is kind of like saying, well, you know, sunlight causes cancer because without sunlight there wouldn't be life, and without life there wouldn't be cancer. Well, thanks a lot. It's a dodge. So nobody knows what causes prostate cancer. There are a number of, presumptions. So what we do when we are attempting to interface with people's health is we recommend that they stop eating food that's going to hurt the body, because if you eat wrong food all of the time, it's going to generate chronic levels of inflammation, low levels of inflammation in the body. That's not a good thing, and then the body's going to break at its weakest point. One of the nutrients necessary for healthy prostate function is selenium, the trace mineral selenium. So whenever we see somebody up against the wall with a prostate condition, in order to help support prostate health, we recommend that they take more selenium. And as far as x-rays are concerned, that's a really complicated situation. The general recommendation for exposure to x-rays is not to exceed a qualification called a REM, 5 REMs a year, R-E-M, 5 REMs a year, or RAD, sometimes it's called a RAD, 5 RADs a year. But quite frankly, medical doctors who give you x-rays all of the time are playing with your health. And if they weren't bad for you, then why do they scurry out of the room when they turn the switch on? I recommend as few x-rays as is possible, but in the literature right now, the recommendation is nobody should have more x-rays per year than gives them 5 RADs or 5 REMs a year. It's kind of a complicated subject. I should probably do an entire webinar on it. I appreciate your trust and your commitment to the cause. Ladies and gentlemen, God willing and the creek don't rise, I'll see you tomorrow. Live long and prosper.